Hi. For the sake of saving time, please sit and we can start this and allow the speaker as much time as possible. And we're going to hear something that really follow on the introductory talks that we heard this morning about the connection between hearing loss and healthy aging. And we have three really outstanding speakers. MARILYN Albert from Johns Hopkins University, who is also one of our collaborators. Alan Jedi, that is one of the world experts on disability from Boston University School of Public Health. And Barbara Weinstein will be talking about psychological aspect. She's from University of New York. And MARILYN, I think that we'll just start and allow you as much time as possible.
Well, it's a great pleasure to be here this morning, and I also would like to thank the organizers for preparing this really important meeting, which I think is going to have very long-term consequences. So just because I'm always in the habit of presenting disclosures, I have here a list of the organizations with which I'm a consultant and have grants that might be relevant, but in point of fact, I think there are no important disclosures for my presentation. I've been asked to speak this morning about the impact of hearing loss on cognition. And what I'm going to be talking about in the brief time that I have is I'm going to focus on the longitudinal studies that show an association between hearing loss and cognitive decline, or hearing loss and incident dementia. I'm going to talk about both cross-sectional and longitudinal studies that show an association between hearing loss and changes in brain atrophy. I'm going to present a hypothesis that I guess is sort of mine, but maybe one that a number of other people are coming up with, about why there might be these links between hearing loss and cognitive decline, and then just say a few words about potential future directions. So you already saw this slide from Frank talking about various things that might be associated with cognitive decline that might be relevant, and I'm going to be talking about the first two. So I'm going to be talking about, as I said, cognition and brain structure and function, and how they might lead to cognitive decline over time. Fortunately, the relevant studies are relatively few in number. There are two types of studies that are relevant to this discussion. Cross-sectional studies that show an association between hearing loss and lower cognitive performance cross-sectionally, longitudinal studies that show an association between hearing loss and declines in cognitive performance over time, and also in incident dementia. In other words, people who were not demented at one point in time and followed longitudinally and subsequently were diagnosed with dementia. There are also cross-sectional and longitudinal imaging studies related to brain changes. Now, because I have a relatively finite amount of time to talk to you this morning, what I wanted to do was really to focus on two different types of studies. One are the longitudinal studies that have been done that used pure tone audiometry to assess hearing. And in point of fact, you are seeing the entire literature on this slide. There are two studies on cognitive decline and two studies on incident dementia, and I'm going to talk to you about two of them. And then there are a number of cross-sectional studies looking at the association between hearing loss and changes in brain volume. I'm going to present one, and then I'm going to talk to you a little bit about a recent study that's actually in press, led by Frank and his colleagues, looking at declines in whole brain volume and regional brain volumes. So the two studies on cognition come from two very large ongoing studies. One is called Health ABC, stands for Health, Aging, and Body Composition Study. It's a population-based study of 3,000 individuals 70 years and older. The longitudinal study that I'm going to be talking to you about comes from the Baltimore Longitudinal Study on Aging. This is a prospective study of older adults. It was started in 1958, and approximately 1989, I actually came up with that from memory, I think maybe Luigi would know better than I, clinical diagnoses were initiated in groups of individuals who were part of what's called the autopsy study. The major outcome in the health ABC study that I'm going to talk to you about, which looked at declines in cognition over time, was the digit symbol substitution test. They looked at a number of other measures, but the one that I'm going to show you this morning is called the digit symbol substitution test. I'll show it to you in a moment, but before I show it to you, I wanted to emphasize that this is a pretty multifactorial test. So you'll see when you look at it that, well, first of all, it's a test that's given to people that they have to do within a defined amount of time. So the faster you do it, the better the score. At a certain point, you have to stop. So speed is relevant to this performance. You'll see that you have to set shift, you have to compare one item with another, go back and forth. So something that we call executive function or set shifting is also relevant, and incidental memory and attention. And I'll show you what I mean. So this is the task. It's actually a wonderful test. The older I get, the more I like this test. It consists of people seeing a series of digits and then a series of symbols, and their task is to copy the symbol that goes with the digit. All right? If you understand the instructions to the task, then your hearing ability isn't relevant, so long as you understand what you have to do. A person is told to try to copy these symbols as quickly as they can. As I mentioned, obviously, then, speed is important. You have to be able to pay attention. Attention is important. You're shifting back and forth between the numbers and the symbols that go with the numbers. But incidental memory is also important, because if you begin to learn these digit symbol pairs, then obviously you get faster. So it's a test that's not of a particular function, but it's very multifactorial, and as it turns out, it's very sensitive. And these are data from the Health ABC study. So these data show us that in these individuals who were followed for up to 6 years, the individuals who had normal hearing performed much better over time than the individuals who had hearing loss. And there was, in fact, a 32% greater rate of cognitive decline on the performance of this test among the people with hearing loss. And this is adjusted for things like age and sex and education and a number of other confounders that you might think about. So this is pretty striking data that individuals, even adjusted for level of hearing loss, over time are performing more poorly on this test that doesn't require that you actually hear once you understand the instructions, everything else is incidental to that. The other piece of relevant data has to do with incident dementia. So I think most of you know what we mean by dementia, but just so that we're on the same page, dementia is a general syndrome. It's not a particular diagnosis of a particular disease. In order to be diagnosed with dementia, you have to have progressive declines in mental ability to the point where you are no longer able to function independently. And typically the way that we define this is that you have to have impairments in 2 or more domains of cognition. And of course, the important thing is that you have to, at one point in time, have been performing better. And this represents a decline. So we're not talking about lifelong disabilities. So when you think about progressive incident dementia, of course, dementia just doesn't happen overnight. It happens very gradually. And the question is how long it takes people to go from being normal to being mildly impaired, to reaching this sort of artificial boundary where we say that they reach a diagnosis of dementia. And the best data related to the relationship of hearing loss and incident dementia comes from the Baltimore longitudinal study on aging. And this is what the data look like. So over here, you see the proportion of people who were dementia-free. So everybody starts out being dementia-free, and then the question is, what's the relationship between hearing loss and time to develop, to be given a diagnosis of dementia? And these lines represent severity of hearing loss. And you can see right away that there's a very striking relationship between hearing loss and time to develop dementia. You look over here, these are the hazard ratios. They show you the strength of the relationship and the significance. And again, these are adjusted for age and sex and education and a number of other covariates that might be relevant to the outcome. So in this study, where 639 people were evaluated followed for over 10 years, there's a really convincing and striking relationship between hearing loss and time to develop cognitive impairment. Now, this is just in case there are questions about the analyses. I should say there were a lot of other ways in which the data were looked at. These findings seem to be extremely robust. Now, what about hearing loss and changes in brain structure? There are a number of studies, this is just one of them, looking at individuals with poor hearing and reduced gray matter, so brain volume in the part of the brain that has to do with hearing, the auditory cortices. And again, if you just look at these lines, this is the left auditory cortex, this is the right. This is demonstrating declines in the volume of gray matter in both of those regions. And this is the control area looking at the motor cortices showing no relationship. Again, cross-sectionally, a very strong finding, but you wonder whether or not this is just true at one point in time and doesn't get gradually worse. But these are data from Frank and his colleagues related to the Baltimore longitudinal study on aging. And they were fortunate because, again, since this is a longitudinal study, they were able to ask the question, not only is there an association between hearing loss and atrophy in the parts of the brain that have to do with hearing, because you could imagine that the connections between those parts of the brain are getting worse, and so that might be the reason for some change in brain volume, but whether or not, in fact, there are changes more globally in the brain. This is a much smaller study because this is a sub-study of individuals who had not only analyses of hearing, but who had imaging as well. So there were 126 participants overall, 75 with normal hearing and 50 with hearing loss. And the mean follow-up was about 6 years. And these are the findings. It's really quite striking. So if you just look here in this last column, you'll see, not surprisingly, that in the brain regions related to hearing, there are significant changes over time. The temporal lobe, which is where these regions are all located, also has a significant change over time. But more importantly, there are global changes. There are more global changes in gray matter, more global changes in white matter, suggesting that perhaps there's a cascading effect, there's a broader effect in brain volume among individuals with progressive hearing loss. This is just a very, for those of us used to looking at brain images, this looks all right, but I know to you it's very confusing. But the main reason that I wanted to put it up is that the interesting thing that nobody really understands is that more of these changes are in the right hemisphere than in the left hemisphere. And I would love to know people's thoughts about why that might be the case. So this is really the bulk of the literature that we have to think about with respect to this question. And I think the conclusions that you can come to from the literature so far are pretty clear. With respect to the longitudinal studies of cognition, hearing loss is clearly associated with declines in cognition over time and with incident dementia. With respect to the longitudinal imaging studies, it's clear that hearing loss is associated with an increased rate of brain atrophy over time, whole brain atrophy, as well as brain atrophy in the focal regions that are related to hearing. So what could explain this association, and why am I presenting both the imaging data and the cognitive data to you this morning? The hypothesis that I've come up with is that hearing loss is associated with increased brain atrophy, and the evidence would suggest that it's just in the areas that have something to do with hearing. But in those individuals who have accumulations of other types of brain pathology, so Alzheimer's pathology, microvascular disease, whatever it might be, you have in essence a double hit. So you have a particular level of pathology, and then over that you add the pathology related to hearing loss, and that's why overall you have these two processes that contribute to declines in cognition and that enable people to cross this arbitrary threshold. And I have here a slide that's trying to present this hypothesis. So if you imagine that these are people who have pathologies of various kinds, Alzheimer's pathology, microvascular disease, whatever it might be, if you add to it the pathology related to hearing loss, the brain atrophy, and you know that a total amount of brain damage is required to reach this threshold, then that might explain the reason that hearing loss is associated with incident dementia. So obviously, if this is a modifiable problem, what might we do about it? Well, in order to know if it's modifiable, in order to know whether or not these relationships really are true and can be impacted, one possibility would be to conduct a randomized clinical trial where you took people, you gave some individuals with hearing loss a hearing aid, treatments of various kinds. You waited to give the other group hearing aids, and you followed them over time. You looked at their cognition. You looked at diagnoses related to dementia. You looked at MRI volumes, and perhaps you looked at other things that we're going to be hearing about on this panel this morning, things like social engagement and quality of life. And if you saw that there was a strong relationship in a randomized clinical trial between hearing loss and incident dementia and cognitive decline, then that would be the time to say there's something that we can do about it. So I think I hope this will be a topic that will be discussed further this morning, and I'm really pleased to have been able to talk to you. Thank you.